upon transesophageal echo, go over some views and such. There's quite a few views that can be taken with the transesophageal probe. I don't expect you know all of them. We probably have on the test a few of the views, and those will be in the review slides that I hand out. But essentially, if you look here, the probe goes down the esophagus and goes behind the heart. And as you can see, we can see pretty good the structure, especially in the atria area. You get really up close to that. The other structures we see, the mitral valve, get pretty close to that, and we can still get very close to the aortic valve and such to see any type of endocarditis or fibroblastoma or something like that that might be on there. You can see the probe there where it it flexes, both antiflex and retroflexes, and it also goes side to side. And of course, the physician can manipulate it with their, by hand to get the image they need. And there's an angle box in the screen, and I know it's hard to see right here. Let me see if I can make this a little bigger. And I guess I can't, but if I move this over here, you can see this box here. This tells what angle we're at, and you can see this when you're doing a TE with the physician, where this would be 0 degrees and this would be 180, and anything in between. For example, at 90 degrees, they're straight down through the heart, inferior, anterior. At 4-chamber, they are almost at 0 to 5 degrees, and so on and so forth. So and there are many different views you can get from mid-esophageal. These are the ones that are labeled ME, to transgastric. These are the ones labeled TG, and so on and so forth, the aorta, and other mid-esophageal views down here. This is just another one showing the typical views of a normal transesophageal study. Now, we're not going to have to know all these because, like I said, this is something that you're going to learn as you do this in the field, and it's going to come to you quite, well, I'm going to say naturally, but it's just going to be something you have to learn, but it's not something you need to know in order to get a job. This is a picture of the mid-esophageal 4-chamber view. You probably see this on the test, so just be aware of what images are in the mid-esophageal view, a 4-chamber view, I should say, and you can see where this is your TEE angle here, where we're 0 and 180, and anything in between. 90 degrees would be your 2-chamber, and so on and so forth. Speaking of that, mid-esophageal 2-chamber at 90 degrees right here, and we're coming right straight down through the mitral valve in this image here. This will probably be on the test, as will this one. Mid-esophageal long axis view. You can see about where that angle is. And these angles are, I want to say, approximate. Okay, not everybody's heart sits at the same exact angle, but this is the long axis view. And we're going to go over a little bit the cut planes of this when I show you a video of this. The cut planes in transesophageal are different than the cut planes that we see in transthoracic. Okay, because of where the probe is and how it's cutting through the heart, these structures aren't the same. They're actually kind of reversed as what they are on our image that we see in transthoracically. Like this is the long axis view, correct? However, as you can see, this is upside down. Well, this is the non-coronary cuffs up here, and this is the excuse me, right coronary cuffs down here, and so on and so forth. We're going to go over that when we see the video. This is the mid-esophageal short axis at the aortic valve level, and this here will be on the test, and you can see the angle down here, 0, 180. This is about 117 degrees. The doctor can bring this here in. And what we tend to see here are the cusps, the non-coronary cusp, left and right. You can always identify the coronary cusp by location on transesophageal echo. The non-coronary cusp, even on transesophageal echo, is always with the septum between the RA and LA. Okay, so it has no coronary artery attached to that cusp. Left over here and right over here. This is the right ventricular outflow tract, and this is the pulmonic valve. So that's how you know where your cusps are. We'll talk more about that, but that'll be on the test. Left atrial appendage view, this will be on the test. This is where the doctor's looking at the left atria bringing in, and the appendage is right here. And this shows the degree angle to get that in by transesophageal. And you can see in this left atrial appendage that this is not clear. This appendage has a clot in there. And you can see the clot right here, which is good. It's been there for a while. This is the transgastric mid-short axis view. This will be on the test. And as you can see, when we cut through with, I'm going to show this on the video, we cut through with transesophageal echo, you can see that the posterior wall of the heart is actually facing this way or upwards, where the anterior is facing down. And that's just because of the way we're cutting through, which is different than transthoracic. This is what the doctors refer to as the bicaval view. And what we see in the bicaval view is a cross-section of the inferior vena cava coming in up here, a prominent eustachian valve on some people here, and the SVC coming down here, this way here. And you can see on this patient here, they have a PFO. We typically perform a bubble study in this view here, and if they do have a PFO, we'll obviously see those bubbles cross here. And this is a much more sensitive test for a PFO than the transthoracic, just because of the ability to get up close to that area, that particular structure. Here's another one of the bicaval view, we call it. And again, eustachian valve, probably even a better view of the SVC coming in. The way we're cutting through this, the SVC is right over here to the right, IVC is over to the left, and I'll show you that in the video. You can see the angle we're at over here. And here you can see a more prominent crista right here at the SVC. And that's something we can see in as I showed in our 4-chamber view. We want to be careful not to identify this as some sort of pseudotumor or something in the heart, as well as this eustachian valve. This is just an image showing that with transesophageal echo, we do a lot of, imaging of the mitral valve. In fact, in the Philips Epic 7 machine, you can actually buy a package that you can post-process, and I believe you can actually pre-process it right there on the machine, post-process the mitral valve after you've taken your 3D images of the valve. You can do that on the TomTec software and actually do a real thorough examination of the mitral valve and what may be wrong with that, primarily with mitral regurgitation. And this just shows at the degrees we're at, the mitral valve leaflets we see. As you know, we have A1, A2, A3, P1, P2, P3, and at different angles at 0 degrees, see we're cutting right down through the ventricle, sort of straight through it, anterior, posterior, and you can see we have anterior leaflet A2, P2 here, anterior and posterior here. At 60 degrees, we have P3, A2, P1, and so on and so forth. And these degrees show us where we're at up here in relation to the aorta and what have you. And you can see where we're cutting through at different degrees and what leaflet P1, P2, P3, A1 leaflet we're cutting through. You can see over 120 degrees, P2, A2, and so on and so forth. So TEE is used a lot for deep examination of the mitral valve in certain hospitals. At Mercy, we don't do a whole lot of deeply examining the mitral valve, although the techs want to, but the doctors aren't extremely interested in that, simply because they'll just transfer patients to a valve center to get this done. They'll identify where the leak is. They don't really need to know if A1 or A2 is particularly bad. They just need to know how bad the MR is, and they'll let the team there at the hospital that does, a deep investigation of this before surgery. Typically, the cardiac anesthesiologist will look at that with the transesophageal probe. And this is just a picture of Philips program. This is obviously not a moving 3D picture, but this has Philips actually has, like I said, a mitral valve program in there where you can get deeply involved in mitral valve and the leaflet structures and whatnot, and exactly where they're going to clip it or repair it or whatever they're going to do to the mitral valve. So that's a whole program you can learn outside of just anything else on the TomTec software, and I'm sure GE and such and Toshiba have their own software for that too. We're going to stop there for this, and I'm going to go ahead and in a few minutes put up a video to show you the cut planes of the transesophageal exam, and hopefully that'll help us better understand the difference between the transesophageal and transthoracic views and how the cut planes differ.